We launched pharmacy because with the brand of Friend of Dorothy, we always try to create products that solve problems for gay. What are the products that exist nowadays that help people prevent hair loss?
I think it's one of the most talked about things in terms of men's health these days. There's a lot of misconception about products, and there's a lot of toxic masculinity that comes into play. If you're susceptible to androgenic alopecia, it's probably going to happen. However, Finasteride has been shown to reduce or stop hair loss in up to 80% of men.
One of our best sellers is DoxyPEP.
I can well imagine.
Can you explain to someone who never heard about it,
Yep.
what is it?
Is post-exposure prophylaxis.
And it prevents what STIs?
Gonorrhea, chlamydia, and syphilis.
If I'm going on Atlantic cruise for a week and I will have unprotected sex every day for 1 week, how would I take doxycycline?
And do you think it will cause people to take more risks?
I think people will do it anyway, and it's all about risk reduction, harm reduction overall, which is more important.
We live in London, and for us, it's really easy to get. However, well, what about the rest of the UK? It's about making it more available to more people.
You forget about the London bubble completely. Healthcare, unfortunately, in the UK is postcode dependent, and not all postcodes will have access to things like DoxyPEP.
We want to discuss weight loss products.
So it's actually a really interesting and exciting era of medicine. We never really had any weight loss tablets or medications, and we now have these GLP-1 medicines. First generation was Ozempic, very popular. Mounjaro has now superseded Ozempic simply because the side effect profile is less and the mechanism of action is much better and stronger.
So if I start taking Mounjaro today, what should I expect?
The obesity pandemic has come about because people would overeat because satiety, seeing good signals in the brain, get confused. People think they're still hungry.
What are the treatments available for erectile dysfunction?
Erectile dysfunction is a big cause of health anxiety in male populations, particularly in the gay community.
So how sildenafil is different from Viagra?
No, it's the same thing.
What's the difference between sildenafil and tadalafil? I think for me that's like the biggest issue and problem. I don't know where else would I find it online and whether I can trust those sources. What if it's like not licensed pharmacy, right? That's why I think for us was important to make it clean, clear, easy, accessible.
Great.
Hi, I'm Azamat.
And I'm Oliver, and we're the founders of Friend of Dorothy.
Today we welcome back Dr. Tony Fordham. After a successful episode last year, we wanted to bring you back to discuss the launch of our pharmacy.
Hi, everyone. How you doing?
All good?
Hey, Tony. So I was thought your name was Tom. Sorry. Hi, Tony. Welcome.
Tony, so we launched pharmacy because with the brand of Friend of Dorothy, we always try to create products that solve problems for gay community. And pharmaceutical products were kind of the next thing. We started all of this just from understanding better ourselves, like what do we want? For me, one question that I had in my mind, for example, was hair regrowth or hair loss. How does it all work? And what are the products that exist nowadays that help people prevent hair loss?
I think it's one of the most talked about things in terms of men's health these days. There's a lot of misconception about products, and there's a lot of toxic masculinity that comes into play with these kind of things as well, unfortunately. A large proportion of men are predisposed to genetic hair loss. And it's associated with testosterone elements and hereditary elements. Luckily, though, there are lots of products available that can slow down, lots of treatments available that people are now seeking and becoming more popular in order to minimize the effects.
How do they work?
In any area of medicine, we always take either conservative approaches, medical approaches, or surgical approaches.
Okay.
And you kind of work up the way through a stepwise ladder. So conservative is usually things like stopping what you're doing, changing diet, healthy lifestyle, that kind of thing. So lifestyle effects. In terms of hair loss, it's quite minimal in what you can actually do in those things. So there's to say things like microneedling, all these kind of things. Maybe that comes under a medical bracket as well, though. But there are things that you can do at home, and like living a healthy lifestyle, vitamins, making sure you get in the right diet, supplements such as biotin, These can improve hair quality. But in terms of actually stopping androgenic alopecia, which is the term for men. So alopecia is hair loss, androgenic is from androgens, which is testosterone. So androgenic alopecia can't really be minimized by lifestyle changes. So the next step up the ladder will be medical changes. So what medical products or tablets or supplements can we take to minimize these things? And then surgical would be hair transplants, which are gaining huge popularity all across the world. And that's where maybe the damage is already done or medical products haven't worked as well as we hoped they would. And I guess in the terms of the pharmacy, we're talking about these medical products and what we can do.
I take products now, medication for hair loss. But you see a lot of things online where they feel a bit scammy, like they're not actually medical products. What's the best medical version? A spray or a tablet?
I mean, I think there are a lot of promises online. And I think you see them on the tube all the time. There's certain companies saying that our vitamins will stop your hair loss. Unfortunately, it's probably not the truth. We can optimize medically, but if you're susceptible to androgenic alopecia, it's probably going to happen, unfortunately. So the main prescription medicines that we're talking about are Minoxidil, is a very popular one, or Finasteride, which is another prescription medicine. And there's also other things we can do in terms of hair treatments that would still come under the medical bracket, such as I've already mentioned microneedling, using commonly used aesthetic products such as polynucleotides of salmon sperm. These things can stimulate hair regrowth as well. But in terms of prescriptions, Minoxidil and Finasteride are the two most common, and lots of men who are suffering or predisposed to androgenic alopecia will be taking these already.
So with
Finasteride.
Finasteride, what's the side effects for something like that?
So there is an array of side effects for Finasteride, and unfortunately, a lot of misconception associated with. And it's because the side effects could be really psychologically distressing for a man. So I believe around 1% to 4% of men taking Finasteride may suffer from sexual dysfunction, which may be erectile dysfunction or loss of libido. Which is a big thing for a man. So there's a tight balance between hair loss, which is overall self-esteem and kind of things that go along with that. And then there's sexual well-being as well. But it's only in 1% to 4% of men. So it's really low numbers of men taking Finasteride. However, Finasteride has been shown to reduce or stop hair loss in up to 80% of men. So the benefit far outweighs the risk. And in almost 60% of men, there is evidence of hair regrowth, particularly at the crown and the perimeters of the hair. So the numbers are really good and the side effect profile is actually quite slim. But there's been really interesting studies in Finasteride in particular where they will take a group of people who don't know about the medicine but are suffering from hair loss, and they tell half the group about the side effects and half the group not about the side effects. The group that who are aware of the side effects will commonly report those side effects. The men who don't know about the side effects do not report the side effects. So you get what we call a nocebo effect. So you've heard of a placebo effect. That's a positive effect from a medicine. A nocebo effect is where men will exhibit the effect of the medicine without having the symptoms. And that's all because of how much psychological distress you get from a medicine. That if you're going to take a tablet and they say there's 1 in 100 chance of you getting a erectile dysfunction, you're going to then stress about getting an erectile dysfunction. So it's really interesting stuff to do with Finasteride, and that's why there's a lot of scaremongering and over-reporting of side effects for it. But as I've already said, 80 to 90% of men can reduce their hair loss.
And as well as reducing hair loss, you mentioned regrowth.
Yeah.
So, for example, if you have receded quite a bit, like, is it targeted regrowth?
In general, there is a general hair regrowth, predominantly at the crown of the head.
Okay.
From what age can men start taking Finasteride?
Any age, and it depends more on when you start seeing symptoms. Unfortunately, lots of men who are predisposed to genetic hair loss can lose hair quite early on in their life. And it's all to do with the testosterone receptor and how much testosterone is converted to DHT, which is the more active form, which can cause hair loss. So the role of Finasteride is to prevent conversion of testosterone to DHT, which saves hair loss and causes hair regrowth. and doesn't affect skeletal muscle mass, because this is another misconception. People think that if you take finasteride, you're not then able to form more muscle, but that's simply not the case. The rate is really low of forming skeletal muscle. So that's one of the reasons why people don't want to take it younger as well, because they think another misconception is that you won't be able to form muscle, lean muscle mass, that kind of thing with finasteride. But the testosterone conversion to DHT doesn't affect that, and it's actually testosterone which is all about muscle mass, not DHT. Does that make sense?
Yeah. And you have to, once you start taking it, is that it? You're taking it forever? Or what would be the effects if you, I don't know, took it for 6 months and then stopped?
It actually takes quite a while to start seeing hair regrowth. So you'd probably counsel patients to take it for a longer period of time anyway before you actually see any signs. I think the estimates are 3 to 6 months. So you wouldn't discontinue the medicine until you saw the regrowth anyway, which can take up to 6 months.
So I take it, and I noticed literally within 3 months that it was regrowing here at the front. I was never really worried about the back.
It tends to favour scalp regrowth. So if you're seeing hair regrowth at the sides, then it's probably more
Doing
growing
at the back as well.
Yeah.
Okay, cool.
So I started taking it 6 weeks ago, and I already feel the difference. I don't know if it's in my head, because maybe hair doesn't grow.
Placebo effect.
Probably. Because probably in 6 weeks the hair is not, can't regrow. But I just already feel difference.
I think it's up to 3 months, so it probably could be.
Yeah.
But the whole thing about placebo effect of medicines is it's not a negative thing. Like, if you're feeling better psychologically and you think you're seeing hair regrowth, that's a good thing.
Tony, one of our best sellers is DoxyPEP.
I can well imagine.
Can you explain to someone who never heard about it, what is it?
So doxycycline is an antibiotic, treatment of lots of different microbial problems. In the gay community, it's predominantly used for treatment of STIs, such as gonorrhea. And that's why it's obviously gained popularity. And only within the past couple of years has it been licensed for use as DoxyPEP. So not PrEP. PrEP is a medicine you take pre-sexual activity. PEP is post-exposure prophylaxis. And there's a lot of controversy about this just in general antibiotic prescribing guidelines and things, and lots of microbiologists think it may lead to more antibiotic resistance forms of gonorrhea, which is already, there are lots of multi-resistant forms, but the overall theory is that if we're reducing the transmission of gonorrhea as it happens using DoxyPEP, therefore we could be reducing overall strains of gonorrhea. Lots of people I know take it very regularly, and transmission of gonorrhea has seen a reduction for sure.
And how do you take it?
You take it within 72 hours of sexual activity.
And it prevents what STIs?
Gonorrhea, chlamydia, and syphilis.
Like every time you have sex, you just basically take it then? Or what if you're having sex twice a week?
So this is, I guess, where some of the trickiness comes, because obviously taking antibiotics regularly can lead to other problems, such as gut problems, this kind of thing. But the theory is in at-risk or high-risk individuals who have either had gonorrhea or predisposed gonorrhea, you will then take doxycycline within 72 hours of having finished that sexual activity.
Okay. So it's more if you're having... You wouldn't take it if you just, for example, had one sexual partner. You're doing it if you're having multiple partners and so on.
Yeah.
And is there a maximum amount of time you should be using it? Like, should I be worried if I'm taking it 4 times a month?
In terms of kind of general antibiotic dosing, no, 4 times a month probably wouldn't cause any long-term issues. Daily dosing, possibly, but people do take antibiotics such as doxycycline for other reasons daily. So overall, it's considered safe to take.
Okay.
So, in an unlikely scenario, if I'm going on Atlantic cruise for a week and I will have unprotected sex every day for 1 week, how would I take doxycycline?
So, within 72 hours of the first exposure, and then 72 hours after the second exposure.
Okay, so I will take it only twice. I don't need to take it every day.
No.
And how long?
Unlike PrEP, obviously, which is every single day.
Yeah.
And how long are you covered for example? So he's on the gay cruise. He's with a different guy every day. So, is he taking it on day one and that's going to cover him for the cruise?
So you take it from within 72 hours of first exposure, and then, so 3 days later, you would then take it again. if the sexual activity was still continuing.
Okay.
If I go from Monday to Sunday,
Yeah.
and my first sex was on Monday,
Yeah.
then 72
You have
hours,
to have taken it by Wednesday,
and then 72 hours later
Thursday,
is
Friday,
is Friday.
Saturday. So you take it on
yeah.
a Saturday.
Yeah. Okay.
Any side effects to it?
So you can get a bit of GI disturbance. So that's gut disturbance. That's with any antibiotic. You are more at risk of sun damage. So SPF, it makes your skin more
On my
sensitive.
Atlantis cruise.
On your, especially on the Atlantis cruise. So yeah, but what's interesting is that the UK is one of the only countries that have licensed this for this purpose. For example, I was in Rio for New Year, and the concept of taking doxycycline there is wild. They do it, but it's not licensed and it's not prescribed regularly, and they have to get it themselves.
Tony, why do you think DoxyPEP is so popular among gay community?
I think has allowed people to continue having more risk-free sexual encounters. The fear of contracting sexually transmitted infections such as syphilis and gonorrhea is reduced, and it will reduce the transmission of high-risk sexually transmitted infections such as gonorrhea in the gay community.
I think DoxyPEP is also popular because it's quite easy to take, because it's in tablets form.
Yeah.
Just 2 pills.
Yeah.
And it's done.
I think, that is why DoxyPEP has become super popular. People understand the concept. I think confusion comes with PrEP. For example, when I was away in South America this winter, they were using DoxyPEP like PrEP because of the similarity in the name and not understanding the concept behind it. But I think on the whole in the UK, particularly in London, DoxyPEP is widely available and widely acceptable.
And do you think with DoxyPEP being so easy to get, it will cause people to take more risks in relation to having sex?
I think even if DoxyPEP is available, I think the risk is still there. So actually, it's the same concept as PrEP. I think people will do it anyway. And it's all about risk reduction, harm reduction overall, which is more important.
Would you agree then, if you are on PrEP, DoxyPEP should always come in combo?
That's a very difficult question. And I think if you are somebody who knows sexual health clinics in London and you use their services very regularly, PrEP is the standard, kind of the gold standard in terms of prescribing for gay men. DoxyPEP hasn't established that yet, and I think you still have to ask for it if you want it. But I think if you are flagged as having a sexually transmitted infection, you will be asked about having DoxyPEP routinely. Similarly to the vaccine, which is now also widely accepted.
Yeah.
What was the reason behind choosing DoxyPEP in the pharmacy prescribing?
So I think obviously we live in London, and for us, it's really easy to get. However, well, what about the rest of the UK? And sure, we have lots of customers for Friend of Dorothy within London. But these things, once you get outside London, it's not as easy. You know, there can be embarrassment going to your local pharmacist. You live in a small town. You maybe had the same doctor for 20 years to go and ask for that, or even your pharmacist. It's about making it more available to more people. And in London, it's great. You can sort of hide in the amount of people. But when you get outside London, you're not able to do so. So I think it was really about making it more accessible to more of the gay community.
I think that is really good. It's a really interesting take in that you forget about the London bubble completely. We're so privileged to live in London and have access to these things. And healthcare, unfortunately, in the UK is postcode dependent. And not all postcodes will have access to things like DoxyPEP.
Yep.
And because there's probably not a health need for it or considered a health need. But one person getting gonorrhea in a small village in Wales, for example, isn't considered a health need. So them having access to things like DoxyPEP is really important if they're self-sourcing.
Obviously, being an openly gay company, it is something that we were able to introduce into our product range very easy. We can get it to people discreetly, and we've got an amazing team of physicians and pharmacists who prescribe it all, and you know, you get exactly the doses you're supposed to take, and it's really well explained.
Yeah, I think having that expertise and knowledge, like I say, it's a postcode lottery in the UK, so where you have lots of pharmacists and doctors in London who are very used to prescribing these things, you may not do in the rest of the country. So if you have access to an online service that does with experts in their field about it, it's a really attractive prospect for sure.
Tony, we want to discuss weight loss products. I think everyone hear buzzwords like Ozempic, Mounjaro. Can you tell us a little bit more, educate us a little bit more on what are these products?
So it's actually a really interesting and exciting era of medicine because, as I've talked about before, with hair loss, where you have conservative medical and surgical management, it's always the same for weight gain and weight loss, for example. So conservative was change your lifestyle, do exercise. Surgical was have a gastric band, have liposuction, something like that. In the middle now, we never really had any weight loss tablets or medications. And we now have these GLP-1 medicines. The first generation was Ozempic, very popular. Mounjaro has now superseded Ozempic a little bit, simply because the side effect profile is less and the mechanism of action is much better and stronger. And it is very popular. There are strict prescribing guidelines in the UK in terms of who this medicine is for. But obviously, it is also accessible to other people if they want to get private prescriptions and things for whatever reason. But it's something that does need safely prescribing and monitoring.
So why is it called GLP-1, GLP-2? What is Ozempic, what's Mounjaro? Is it like brand names?
So these are brand names. Ozempic is the brand name for the first generation GLP-1. Mounjaro is a second generation. Third generations are being licensed currently, which supposedly have better mechanism of actions and are stronger effects and minimal side effects. And they each have their medical name as well. So you'll hear lots of different versions.
And if somebody was taking Mounjaro, how do they take it?
So typically they are peptides that are injected once weekly by a quick pen, which is probably everyone has seen like an insulin diabetes pen. It's a similar mechanism. You wind up the pen and then you inject it subcutaneously into fat. The needle is tiny. It's like barely visible. And that is one of the things why that might be a barrier to people taking it because they think, oh, it's going to hurt. It's barely noticeable, to be honest. And it's once weekly. You can take tablets as well. From what I know, Ozempic has a tablet form. Semaglutide is the medical name. You take it once daily, and that's simply for people who don't want to inject a medicine once weekly, but comes with possibly more side effects and less strong in action.
So if I start taking Mounjaro today, what should I expect?
So responsible prescribing of Mounjaro means that you start on a low dose and titrate up to how strong a dose you need in order to see noticeable weight loss. Within around 48 to 72 hours, patients report, when they first take it, reduction in appetite, which is its main mechanism, GI disturbances, so nausea, vomiting, possibly diarrhea, and that's very common. And then other things, so people notice that they get dehydrated, unfortunately. One of its mechanisms is to urinate lots to reduce sugar intake in the gut. So people feel a little bit tired or dehydrated from that as well.
So once I start taking Mounjaro and I feel like I've lost appetite, do I need to lean into it, like stop eating as much as before?
You should eat to satiety, so to feeling full, which the whole point is you will eat less because you feel full quicker. I think it's going to be a really interesting medicine because I think it will cure a lot of disease in the world when it's become more accepted and widely available, such as heart disease, obesity, these kind of things.
In my daily lifestyle routine, if I had this size of portion for breakfast, then I'll feel like, okay, I ate just 1/3 of it and I'm full, and then I just stop. Yeah. And then same for lunch. I just feel like after eating 1/3, I'm full. And that's how it works.
Exactly. And I think the obesity pandemic has come about because people would overeat and would have their portion size and then eat more because satiety signals in the brain get confused. People think they're still hungry. There's a lot of evidence to say boredom is a root of hunger, that kind of thing. So it makes people feel fuller much quicker than they ordinarily would, which then causes weight loss overall. And you don't necessarily notice that you're not eating as much. That's one of the main things people say. They don't notice hunger or loss of appetite, which then naturally makes you eat less.
So if I go to gym, and for me it's important to, for example, keep my muscle growing, how does that impact?
So it can do, and we've seen a lot of people using Mounjaro in different ways. So not necessarily for significant weight loss if they're overweight, but people who want to lose fat and maintain lean muscle mass, for example. So it's very popular in the bodybuilding community for bulk cut cycles. So in the cut, you would take a Mounjaro, for example, and you would then notice more significant weight loss. But at the same time, obviously, you're going to notice muscle loss, but that's the same as any diet, unfortunately. There are other problems with it as well. So once you start losing around more than 5 kilograms, if you do it too quickly, you start noticing hair loss. You might notice loss of fat pads in the face, which are very important for just facial structure. This is why the advent of Ozempic face and in aesthetic medicine, for example, there's been a huge rise in people seeking treatments post significant weight loss. There's a way to do it. The problem is people get their low dose and they see, hey, 3, 4, 5 kilograms weight loss in the first week. Most of that is water weight, but they like it. So then they push the dose and they're continuously chasing the dose.
Yep.
And the problem with that is that you lose weight too quickly and that causes the side effects. Responsible prescribing and monitoring means that you start low and you stay low. But and you titrate up to need. So if people then start feeling hunger, if they still have weight to lose, then you titrate the dose up, not because you're seeing significant weight loss, because that can be dangerous.
Yeah.
So you mentioned with Mounjaro, you need to inject it. That sounds quite scary. Does it hurt? Like, how does it work?
It comes in a click pen and you wind the dose as per the dosage. And the needle, it comes with a cap. So you unsheath the needle and you almost cannot see the needle. If you turned it sideways, it would almost disappear. It's probably the same thickness as a few hairs, for example, which means that, yes, you might feel a very tiny sharp scratch, but the psychological aspect is what makes you feel more pain than actually the pain of it. It doesn't hurt at all.
Doesn't hurt at all. Okay, cool. And I guess some people would say that taking Mounjaro is cheating.
I think it depends on the purpose of taking Mounjaro. It is a licensed medicine used for weight loss. And I think lots of people have really struggled with weight loss over time. And yes, it's cutting a corner, but we do so many things in our daily life to cheat. We weren't evolved to use moisturizers, but we do.
And I guess the ultimate thing with it is it helping people live better lives?
Certainly. And one of the biggest barriers to people seeking healthcare or treatment is fear of being labeled as something, so obese or things like that. So you're helping people in that way. You're reducing cardiovascular disease, you're reducing obesity. The main thing is people then feel more confident and therefore they may go into the gym that they've never ever done in their life. And therefore you're also physically helping them to seek better health. There's loads of stats going around at the moment. So the burden of healthcare in the next few years will reduce significantly because we're reducing obesity and cardiovascular disease. And then I saw a funny meme that was airplanes are saving so many litres of fuel now because people aren't as heavy. So there's going to be so many hidden benefits to it when prescribed correctly for the right patient populations.
Mounjaro is expensive, relatively, but I heard that people are saving money on food, so it's kind of breaks even.
So it all breaks even. Yeah, exactly. It swings and roundabouts, isn't it? I mean, it is a more expensive medicine. The way medical licensing goes is that when a new medicine comes out, the pharma companies have priority over it. And then as it becomes more widely available, it will come off branding, for example, and there will be generic versions available. Like paracetamol, when it was first released, probably cost a lot more than the 50p it does now. But the benefits of medicines for the right people for Mounjaro far outweigh the cost, really.
What are the licensed brands that are approved by NHS so that people know what brands to trust and what brands not to trust?
The main ones currently are Ozempic, which is also known as Wegovy. That's one of the main brands, and Mounjaro. So Mounjaro is obviously a very popular medicine. Why did you decide to include it in the pharmacy?
I think with Mounjaro, certainly when I've looked at it online, most of the people talking about it, which I would presume, therefore taking it, is women. And I think with men, again, they're less likely to feel comfortable to go and ask. And then if you're outside of London, it can be even more difficult, to go to your local doctor, your pharmacist, and be able to openly ask for these things. The same with all the products we're selling in our pharmacy. We've deliberately tried to curate them, not just for men, but for gay men, because we've chosen products that, gay men will want to take, that are genuinely beneficial health-wise for gay men long-term. We really went back and forward whether to include it or not. We spoke to a lot of our customers about it and found that it was something they wanted but didn't know how to go about getting. So yeah, it was about really making it accessible to them and making it so that they can get it without any shame or feeling guilty or without having to worry about pride of going and asking for it. You know, they can order it online. It's delivered in discreet packaging with advice and guidance on how to take it and just everything that they're going to need to take it safely. So yeah, I think that's why it's an important product to have within the portfolio.
I think there's lots of shame in the gay community, isn't there? And I think having an online pharmacy where you can access these things, so hair loss, a big root of shame, weight gain, being obese, a huge root of shame, sexually transmitted infections, another huge root of shame in the gay community. So having somewhere online where you can access all of those things is really necessary for the community.
What we're trying to do with Friend of Dorothy is create a wellness hub, something that has where gay men can go and it's for them. You know, there's lots of these things already exist for other communities such as mums and so on, but there's nowhere just for gay men to go.
Tony, when we were opening pharmacy, one of the biggest asks from our community was to explain erectile dysfunction treatments. Could you please share a little bit more on what are the treatments available for erectile dysfunction?
So erectile dysfunction is a big cause of health anxiety in male populations, particularly in the gay community. There are medical treatments available. Most commonly, the most famous, of course, is Viagra. Do you know the story of how Viagra came about?
No.
No? It's a quite well-known story. So most of the medicines are blood pressure tablets. And so a pharma company, I believe in the US, a long time ago, developed this blood pressure tablet, and then one of the noticed side effects, which they hadn't anticipated, was that all these men got erections. Aging men who needed blood pressure tablets suddenly walking around with sexual function, which they'd not had with their partners for a long time. These companies saw dollar signs and it went huge. It's one of the biggest recorded pharma wins in the whole world in history, because what they originally found was a blood pressure tablet for a health need has now been marketed as a sexual dysfunction, erectile dysfunction tablet, and it's one of the biggest selling tablets of all time, for obvious reasons.
What is the active ingredient in Viagra? Because Viagra is just the name of the brand, right?
Yeah, so it's sildenafil, is the blood pressure tablet, and it's colloquially known and the marketing as Viagra. It's the brand name.
So how sildenafil is different from Viagra?
No, it's the same thing. So sildenafil is the name of the medicine. Viagra is the brand name. So not all Hoovers are vacuum cleaners. That's the example, right? So there's lots of different brand and unbranded versions of sildenafil.
So how do you take sildenafil?
So you take it pre-sexual activity, usually about 30 to 60 minutes beforehand.
And how long does it last?
It lasts around 4 hours.
Okay. What's the difference between sildenafil and tadalafil?
So tadalafil is one of the newer mechanism of action treatments for erectile dysfunction, and it's very interesting because it's also a treatment that was originally designed for something else, pulmonary hypertension, and is now widely used as a longer acting Viagra. It can last up to 36 hours and therefore has gained huge popularity in gay communities, for example.
Yep.
People who go out on weekends and want to have sex for 36 hours, for example. So it's super popular. It also removes the element of anticipation. You can take it in different ways. So you can take it daily as a really low dose, which allows you to have normal erectile function, or you can take it in a higher dose pre-sexual activity as well.
Why tadalafil and sildenafil are popular among gay community?
I think there's a lot of health anxiety in gay men in particular about erectile dysfunction, toxic masculinity that we were all raised with, that kind of thing. So if you're not able to perform sexually, it's more that there probably isn't a physiological effect. It's more a psychological effect, which can then cause erectile dysfunction. Whereas Viagra originally is for people with a physiological effect, less a psychological effect.
Yeah.
And I think there's a lot of psychological strain in gay communities, shame, fear, things that we've talked about before.
Yeah.
And then there's also the other side of it. So obviously these medicines are popular among people who have party play, chemsex, that kind of thing, because these drugs can cause erectile dysfunction, and therefore that is a physiological effect, and so you need something to counteract that.
Fair.
The use of these medicines, I think, is very important for the gay community, but why have you included to use it in the pharmacy?
We built all of the products around our own experience and our own needs. And I think for me, personally, buying erectile dysfunction treatments is always associated with shame. I would struggle to go to Boots and fill in the form in front of the cashier to ask for Viagra, because there are always pressure. There are people behind you, and you're like a kind of young man looking for ED treatment. And I have an experience of taking both sildenafil and tadalafil. Again, sildenafil is generic Viagra, tadalafil is generic Cialis. And I do feel quite a big significant difference, because for sildenafil, which is equivalent of Viagra, I had side effects of a little bit of blocked nose and a little bit of blood rush on my face, which I didn't like. So I tried tadalafil, which is generic for Cialis, and I don't have those problems at all. And for me, just taking like a small dose daily brings me back to my normal life when in your 20s, when you can always have sex whenever you want, and you really don't have back in your head any kind of thought, oh, maybe I won't be able to perform.
There's a lot of anticipation effect of these medications, and it's really, it's considered, and especially in the gay community, unsexy to take a Viagra 30 minutes before intercourse if it's not unplanned. And that's why tadalafil is really exciting for the gay community and more spontaneous, for sure. And you get significantly less side effects as well.
Yeah, Tony, this was very, very helpful as usual. Thank you so much for coming. And I'm sure we'll invite you very soon.
To discuss more,
Absolute pleasure, Tony. Thank you.
Thank you.